Welcome to this lecture on Introduction to Radiography. In this session, we will briefly introduce the basic concepts of radiography and its importance in modern medical practice. Radiography is an essential diagnostic tool that allows visualization of internal body structures and supports accurate clinical decision-making. This lecture is prepared and presented by Dr. Abdulgnee. Let us begin. Radiography is the science of using radiation to produce images of the tissues, organs, bones, and blood vessels within the human body. These images play a vital role in diagnosis, treatment planning, and patient care. What is the unknown ray? The unknown ray is known as the X-ray, a form of electromagnetic radiation that forms the basis of diagnostic radiography. International Day of Radiology, celebrated on the 8th of November, marks a historic milestone in medical imaging. On this day in 1895, Wilhelm Conrad Röntgen discovered the X-ray, revolutionizing medicine and diagnostic science. Displayed here are three historic images: the scientist Wilhelm Röntgen, his wife, and the first X-ray image ever taken, an X-ray of her hand, symbolizing the birth of radiography. Why do we use radiography? Radiography is performed to create images of the body's internal organs and structures, and to accurately interpret these images in order to diagnose disease. Simply, it allows us to see what is happening inside the body without the need for surgery. Conventional radiography is based on the principle of X-ray absorption by different body tissues. Each tissue absorbs X-rays differently, allowing their varying densities to appear on the radiographic image. There are four basic radiographic densities: gas, fat, soft tissue, and calcification or bone, arranged from lowest to highest density. In addition, a fifth density, metallic density, may be seen when metal objects are present. Shades of gray in radiography represent the different degrees of X-ray absorption by body tissues. On the image, air appears black, fat appears dark gray, soft tissues appear light gray, while bones and calcifications appear white. Metallic objects appear intensely white due to their very high density. These shades of gray are what allow radiologists to differentiate normal anatomy from pathology, as illustrated in the accompanying images. How is a radiograph taken? The patient is positioned on the examination table, while an X-ray generator produces a controlled beam of X-rays. These X-rays pass through the body and are absorbed at different levels by various tissues. The remaining X-rays reach the detector, creating an image that reflects the internal structures of the body, as shown in the illustrated images. Conventional radiography produces a two-dimensional image of the body, which can be captured in multiple projections. A frontal X-ray is taken either postero-anterior, PA, or antero-posterior, AP. Other projections include lateral, oblique, and additional specialized views, depending on the area being examined. The accompanying images illustrate these different body views, helping to provide a complete assessment of the anatomy. Conventional radiography can also be performed using a portable X-ray machine, which is especially useful when a patient cannot be safely moved to the radiology department. However, portable X-rays have several limitations: longer exposure time, lower image quality, challenges in proper patient positioning, limited radiation protection. Despite these drawbacks, portable radiography remains an important tool in critical care and bedside imaging. Radiation hazards are an important consideration in medical imaging. Ionizing radiation, used in X-rays and other imaging modalities, can be harmful, so it should only be used when the benefits clearly outweigh the risks. Unnecessary radiation exposure must be avoided. The guiding principle is a LARA, as low as reasonably achievable. This means using appropriate equipment and proper technique, limiting the size of the body area exposed, reducing the number of films and repeated examinations, avoiding unnecessary imaging, considering alternative techniques like ultrasound or MRI whenever possible. Radiation can cause mutations in cells, particularly in gonads, leading to congenital anomalies. Exposure of a fetus in utero may result in malformations or an increased risk of childhood cancers such as leukemia. Long-term exposure also increases the risk of radiation-induced cancer in general. Careful adherence to safety principles protects both patients and healthcare workers. Common radiographs include several standard views of the skull, frontal and lateral skull X-rays for general assessment, occipitomental view, OMV, to visualize facial structures, Waters view, which is particularly useful for evaluating the sinuses. These standard projections help clinicians assess anatomy and detect abnormalities effectively. Lateral neck X-rays can reveal important pediatric and adult airway findings. For example, an enlarged epiglottis appears on the lateral view resembling a thumb sign, which may indicate epiglottitis. Similarly, adenoidal hypertrophy can be seen encroaching on the nasopharynx, potentially causing airway obstruction or chronic nasal symptoms. These radiographic signs are crucial for accurate diagnosis and timely management. Brief. Common radiographic studies also include chest X-ray, postero-anterior (PA) view, for a standard assessment of the lungs, heart, and mediastinum, chest X-ray, lateral view, to provide a side perspective and detect abnormalities not visible on the PA view, plain abdominal X-ray, which is useful for evaluating bowel obstruction, perforation, or other abdominal pathology. These studies are fundamental tools in everyday clinical practice. Common musculoskeletal radiographs include standard anteroposterior (AP) and lateral views of major joints, elbow X-ray, AP and lateral, knee X-ray, AP and lateral, shoulder X-ray, AP and lateral, foot X-ray, AP and lateral. These views are essential for assessing bone structure, joint alignment, and detecting fractures or other abnormalities. Thank you for watching this lecture on radiography. We hope you found the information useful and easy to understand. If you enjoyed this video, don't forget to like, subscribe, and share to stay updated with more educational content. Stay curious, stay informed, and see you in the next lecture.